Welcome to this pharmacology quiz series, where we test your knowledge with high-yield concepts. In this video, we will focus on antihypertensive drugs, a key topic in cardiovascular pharmacology. These drugs are used to manage conditions such as hypertension, heart failure, and chronic kidney disease, among other conditions. This quiz contains 20 recall-type multiple-choice questions designed to reinforce your understanding. Each question has 5 options, followed by the correct answer and a brief explanation. The video will pause briefly after each question to allow you time to think before revealing the answer. So, let's get right into it. Question 1. Which of the following statements about ACE inhibitors and their mechanism of action is correct? Option A. They inhibit angiotensin II formation by blocking ACE. Option B. They directly block angiotensin II receptors competitively. Option C. They increase aldosterone secretion from adrenal cortex. Option D. They reduce bradykinin levels by enhanced degradation. Option E. They stimulate renin release via beta-1 blockade. The correct answer is option A. They inhibit angiotensin II formation by blocking ACE. This is because ACE inhibitors prevent conversion of angiotensin I to angiotensin II, reducing vasoconstriction and aldosterone secretion. All other options describe mechanisms of different drug classes or incorrect physiological effects. Question 2. Regarding thiazide diuretics and their site of action, which statement is incorrect? Option A. They act on distal convoluted tubule sodium chloride cotransporter. Option B. They increase calcium reabsorption in distal tubule. Option C. They reduce plasma volume initially to lower blood pressure. Option D. They inhibit sodium-potassium ATPase directly in tubules. Option E. They decrease peripheral resistance with chronic use. The correct answer is option D. They inhibit sodium-potassium ATPase directly in tubules. The explanation is that thiazides act on the sodium chloride cotransporter, not the sodium-potassium ATPase pump. All other options correctly describe known pharmacological effects of thiazide diuretics. Question 3. Which of the following beta blockers is most likely to exhibit intrinsic sympathomimetic activity? Option A. Propranolol. Option B. Atenolol. Option C. Pindolol. Option D. Metoprolol. Option E. Bisoprolol. The correct answer is option C. Pindolol. This occurs due to pindolol having partial agonist activity at beta receptors, producing mild stimulation while blocking stronger agonists. All other options are pure antagonists without intrinsic sympathomimetic activity. Question 4. Which statement correctly describes the pharmacokinetics of amlodipine among calcium channel blockers? Option A. It has a long half-life allowing once-daily dosing. Option B. It undergoes rapid first-pass metabolism with short duration. Option C. It is eliminated unchanged primarily via kidneys. Option D. It requires multiple daily dosing due to short action. Option E. It accumulates rapidly causing acute hypertension. The correct answer is option A. It has a long half-life allowing once daily dosing. This is because amlodipine has a prolonged half-life that supports stable plasma levels with once daily administration. All other options incorrectly describe short-acting drugs or inaccurate elimination characteristics. Question 5. Which antihypertensive drug is most associated with angioedema? Option A. Losartan. Option B. Enalapril. Option C. Amlodipine. Option D. Hydrochlorothiazide. Option E. Metoprolol. The correct answer is option B. Enalapril. The reason is that ACE inhibitors increase bradykinin levels, which can lead to angioedema, a potentially serious swelling of the deeper layers of the skin, often affecting the face, lips, tongue, and airway. All other options do not significantly increase bradykinin levels and therefore are not commonly associated with this adverse effect. Question 6. Which of the following is not a recognized adverse effect of loop diuretics? Option A, hypokalemia. Option B, hypercalcemia. Option C, ototoxicity. Option D, hypovolemia. Option E, metabolic alkalosis. The correct answer is option B, hypercalcemia. This is explained by loop diuretics increasing calcium excretion, which leads to hypocalcemia rather than hypercalcemia. All other options are well-established adverse effects associated with loop diuretics. Question 7. Which statement about angiotensin receptor blockers and their clinical use is correct? Option A. They block angiotensin II at AT1 receptors selectively. Option B. They increase bradykinin levels similarly to ACE inhibitors. Option C. They are contraindicated in diabetic nephropathy. Option D. They reduce renin secretion directly from kidneys. Option E. They inhibit aldosterone synthesis independently of angiotensin II. The correct answer is option A. They block angiotensin II at AT1 receptors selectively. This is because angiotensin receptor blockers selectively inhibit AT1 receptors, preventing angiotensin II effects without affecting bradykinin. All other options incorrectly describe their mechanism or clinical role. Question 8. Which of the following drugs is a centrally acting alpha-2 agonist used in hypertension? Option A, clonidine. Option B, prazosin. Option C, hydralazine. Option D, labetalol. Option E, nifedipine. The correct answer is option A, clonidine. This occurs due to clonidine stimulating central alpha-2 receptors, reducing sympathetic outflow and lowering blood pressure. All other options act through different mechanisms and are not central alpha-2 agonists. Question 9. Which statement is incorrect regarding calcium channel blockers and their vascular effects? Option A. They reduce peripheral vascular resistance by arteriolar dilation. Option B. Dihydropyridines primarily affect vascular smooth muscle. Option C. Non-dihydropyridines decrease heart rate and contractility. Option D. They increase intracellular calcium in vascular smooth muscle. Option E. They can cause reflex tachycardia with rapid vasodilation. The correct answer is option D. They increase intracellular calcium in vascular smooth muscle. The explanation is that calcium channel blockers reduce calcium entry into cells, leading to vasodilation. All other options accurately describe their pharmacological and physiological effects. Question 10. Which drug is most likely to cause first-dose hypertension due to alpha-1 blockade? Option A, prazosin. Option B, propranolol. Option C, enalapril. Option D, amlodipine. Option E, spirolactone. The correct answer is option A, prazosin. This is because alpha-1 blockers like prazosin can cause marked vasodilation after the first dose, leading to hypertension. All other options belong to different drug classes and do not typically cause this specific first dose effect. Question 11. Which of the following antihypertensive drugs is contraindicated in pregnancy due to teratogenicity? Option A, methyldopa. Option B, labetalol. Option C, enalapril. Option D, nifedipine. Option E, hydralazine. The correct answer is option C, enalapril. This is because ACE inhibitors are teratogenic and can cause fetal renal damage and developmental abnormalities. All other options are considered relatively safe or commonly used in pregnancy. Question 12. Which statement about hydralazine and its mechanism is correct? Option A. it causes direct arteriolar smooth muscle relaxation. Option B, it blocks angiotensin converting enzyme activity. Option C, it inhibits sodium reabsorption in distal tubule. Option D, it antagonizes beta-adrenergic receptors selectively. Option E, it reduces calcium influx in cardiac myocytes. The correct answer is option A, it causes direct arteriolar smooth muscle relaxation. The explanation is that hydralazine directly relaxes arteriolar smooth muscle, leading to decreased peripheral resistance. All other options describe mechanisms of different antihypertensive drug classes. Question 13. Which of the following statements about spirolactone is incorrect? Option A, it antagonizes aldosterone receptors in distal nephron. Option B, it causes potassium retention leading to hyperkalemia. Option C, it reduces sodium reabsorption and water retention. Option D, it increases renin secretion by direct stimulation. Option E, it may cause gynecomastia due to hormonal effects. The correct answer is option D, it increases renin secretion by direct stimulation. This is explained by spirolactone not directly stimulating renin release, but acting as an aldosterone antagonist. All other options correctly describe its pharmacological effects and adverse effects. Question 14. Which of the following drugs has combined alpha and beta blockade properties? Option A, labetalol. Option B, atenolol. Option C, verapamil. Option D, losartan. Option E, indapamide. The correct answer is option A, labetalol. This occurs due to labetalol blocking both alpha-1 and beta-adrenergic receptors, reducing blood pressure through dual mechanisms. All other options lack combined alpha and beta blocking activity. Question 15. Which statement correctly compares loop diuretics and thiazide diuretics? Option A, loop diuretics inhibit NKCC transporter in thick ascending limb. Option B, thiazides act primarily in proximal tubule sodium reabsorption. Option C, loop diuretics reduce calcium reabsorption significantly. Option D, thiazides are ineffective in patients with renal impairment. Option E, loop diuretics have weaker natriuretic effect than thiazides. The correct answer is option A, loop diuretics inhibit NKCC transporter in thick ascending limb. The reason is that loop diuretics block the sodium-potassium chloride cotransporter in the thick ascending limb, producing potent diuresis. All other options are incorrect comparisons or inaccurate statements about their pharmacology. Question 16. Which of the following antihypertensive drugs requires monitoring of serum potassium due to risk of hyperkalemia? Option A, spirolactone. Option B, amlodipine. Option C, hydrochlorothiazide. Option D, propranolol. Option E, hydralazine. The correct answer is option A, spirolactone. This is because spirolactone is a potassium-sparing diuretic that reduces potassium excretion, increasing risk of hyperkalemia. All other options do not significantly raise potassium levels in clinical use. Question 17. Which statement about beta blockers and their contraindications is incorrect? Option A, they are contraindicated in severe asthma due to bronchospasm. Option B, they may mask hypoglycemia symptoms in diabetic patients. Option C, they increase heart rate via beta-1 receptor stimulation. Option D, they reduce cardiac output and renin release. Option E, they can worsen peripheral vascular disease symptoms. The correct answer is option C, they increase heart rate via beta-1 receptor stimulation. This is because beta blockers reduce heart rate by blocking beta-1 receptors, not stimulating them. All other options correctly describe known contraindications or effects of beta blockers. Question 18. Which of the following drugs is most selective for beta-1 receptors among antihypertensives? Option A, atenolol. Option B, propranolol. Option C, nadolol. Option D, timolol. Option E, pindolol. The correct answer is option A, atenolol. This is explained by atenolol being a cardioselective beta-1 blocker with minimal beta-2 activity at usual doses. All other options are non-selective or less selective beta blockers. Question 19. Which statement is correct regarding minoxidil and its pharmacological action? Option A, it opens potassium channels causing vasodilation. Option B, it inhibits angiotensin II receptor binding competitively. Option C, it blocks calcium entry into vascular smooth muscle. Option D, it acts centrally to reduce sympathetic outflow. Option E, it inhibits renin secretion from juxtaglomerular cells. The correct answer is option A, it opens potassium channels causing vasodilation. The explanation is that minoxidil activates potassium channels in vascular smooth muscle, leading to hyperpolarization and vasodilation. All other options describe mechanisms of different antihypertensive drug classes. Question 20. Which of the following is not a recognized drug interaction with ACE inhibitors? Option A, increased hyperkalemia with potassium supplements. Option B, reduced effect with nonsteroidal anti-inflammatory drugs. Option C, increased hypertension with diuretics. Option D, reduced lithium levels due to enhanced clearance. Option E, increased risk of renal impairment with NSAIDs. The correct answer is option D, reduced lithium levels due to enhanced clearance. This is because ACE inhibitors actually increase lithium levels by reducing its renal clearance, leading to toxicity risk. All other options are recognized interactions associated with ACE inhibitors. The quiz is now complete, and thank you for taking part in this antihypertensive drugs challenge. Don't forget to drop your score in the comments so I can see how you performed. For further study, I recommend Katzung and Trevor's Clinical Pharmacology, Rang and Dale's Pharmacology, and the British National Formulary, with guideline references aligned to the BNF. These resources will help deepen your understanding and reinforce key pharmacological principles. Subscribe for more high-yield pharmacology quizzes and learning content.